Welcome back guys. Now in this video, let's discuss about lung cancers. So I am asking you, tell me how many types of lung cancers are there? Okay, how many types of lung cancers? I am just directly starting with the lung cancers. In the end, I will be discussing also a benign condition, benign tumors of the lung. How many types of lung cancers are there? See, there are 4 types of lung cancers which you should know for your exam. Okay, there are 4 types of lung cancers. So what are these 4 types of lung cancers? Squamous cell carcinoma. Okay, squamous cell carcinoma. Second type is adenocarcinoma. Third type is small cell carcinoma. And the last variety is large cell carcinoma. Okay, so squamous cell carcinoma, adenocarcinoma, small cell carcinoma and large cell carcinoma. There are 4 types of lung cancers. Now, see where these cancers are going to occur. Okay, in the apex of the lung, in the middle lobes or in the base of the lung. Okay, see, the first thing which I want you to know, see squamous is starting with which letter? S. Small cell is starting with which letter? S. So S and S, right? So small cell carcinoma is also starting with the letter S. So S, it is going to the, see, small cell, it is going to sound like central, right? Small, central, okay, something like that. So the squamous cell carcinoma is going to locate in center, central location. Okay, it's going to occur centrally in the lung. Small cell also centrally located. Adenocarcinoma and large cell carcinomas, they are going to occur in the periphery, and large cell also periphery. So they are going to occur in the peripheral location. Now whenever I am talking about the lung cancer, see, that is the most common cancer that is going to cause the death worldwide, the most common cancer causing the death worldwide. Okay, this is a lung cancer, sir. See, whenever I am talking about lung cancer, what will come to your mind? What is the risk factor? The most important risk factor is smoking. Smokers will get the lung cancers, right? So which lung cancers are associated with smoking? So smoking is the most common risk factor. So which lung cancers are going to be associated, which type of lung cancer is associated with smoking? Again same thing, see, small cell and squamous, they are starting with the letter S. S means smoking, okay, smoking, S for S, smoking. So small cell and squamous. So small cell and squamous, they are associated with smoking, and you also know they are located where? They are located centrally. Okay, they are located centrally. Then which type of cancers are seen? Non-smokers. Even non-smokers will get the cancer. Okay, even non-smokers will get the cancer. So non-smokers will get which type of lung cancer? Non-smokers are going to get, let me write here, you know it, it's a large cell. Mainly I should write first adeno, okay, adenocarcinoma and large cell. Okay, large cell carcinoma, adenocarcinoma and large cell carcinoma. So smoking associated are squamous and small cell. Non-smokers, in non-smokers you can see adenocarcinoma and large cell carcinoma. These two are peripherally located. Okay, they are located peripherally. See, if someone comes to and ask you, what is the most common lung cancer out of all this? What is the most common lung cancer? This is a question. What is the most common lung cancer? What do you think? Is it squamous cell, small cell, adenocarcinoma or large cell carcinoma? What is the most common lung cancer? See, these 4 are not the most common lung cancers. These are not the most common lung cancers. The most common lung cancers are going to be secondaries. Note. Okay, usually lung by itself, okay, it won't develop any cancers usually. Okay, so primary lung cancers are not common. Secondaries, most common lung cancers. Most common lung cancers are secondaries. So you know secondaries, right? Okay, secondaries means cancer have originated in some other organ and it got metastasized to different parts of the body, also to the lung. It's coming to the lung, it's getting deposited in different places in the lung, it's growing. Okay, I will show you that image also. So the most common cause of lung cancer, the most common lung cancers are secondaries, are METs. Okay, METs means metastasis. Now here itself I am telling you, if a patient is having lung cancer because of this METs, if you take an X-ray, okay, if you take an X-ray, how the X-ray is going to look like? So on X-ray it's going to show cannonball appearance, cannonball metastasis. So what is this cannonball metastasis on X-ray? That I will discuss, that I will show you the image also. Okay, so whenever there is metastasis to lung, whenever metastasis is happening to the lung, so those METs in the lung are going to give you the cannonball appearance. Okay, so done. After this, what else you should know for your exam is, see here itself, let me write you, explain you what are the genetics involved. Okay, what are the genetics involved? See, in lung cancers, okay, different types of lung cancers are there. When you will get the squamous cell carcinoma, when you will get the adenocarcinoma, so which genes are going to be mutated? See, the squamous cell carcinoma is because of P53 gene mutation. So P53 gene, the tumor suppressor gene, it is mutated, that can cause squamous cell carcinomas. Adenocarcinomas are because of which mutations? Adenocarcinomas are because of EGFR. Okay, activating mutations. Okay, activating mutations in EGFR1 are ALK1 mutations, KRAS mutations. Okay, all of these activating mutations of KRAS gene, ALK gene and EGFR1 gene, they can lead to adenocarcinoma. Okay, they can lead to adenocarcinoma. Small cell carcinoma is also important. In small cell carcinoma, which genetic abnormalities are seen? It is LMIC. See, there is MIC, right? LMIC, NMIC, CMIC. We have discussed these things in a lot of places. Okay, neuroblastoma, in endocrinology also we have discussed NMIC amplification, neuroblastoma, NMIC amplification is seen. In the same way, here small cell carcinoma. See, small cell carcinoma, what? Lung. So lung for LMIC. Okay, LMIC amplification. LMIC amplification is going to be seen in small cell carcinoma of the lung. So what you should know for your exam? P53 gene mutations are associated with squamous cell carcinoma, P53 gene mutations. EGFR1 gene and ALK and KRAS gene mutations, activating mutations are seen in adenocarcinoma. LMIC gene mutations are seen in small cell carcinoma. Okay, now as there is a possibility here, let me add important points here itself. Let me add a page. See here. Now let's discuss about LMIC, NMIC and CMIC. Okay. See, LMIC amplification, NMIC amplification, CMIC amplification. These are the three mixed transcription things. See, LMIC amplification is associated with, LMIC amplification is seen in which type of cancer? Just now we have discussed L for lung. Which lung cancer? Small cell carcinoma of the lung. Small cell carcinoma of the lung. N for neuroblastoma. NMIC amplification, okay, is seen in neuroblastoma. And CMIC, so I always remember C for cheek. Okay, C for cheek. There is this African child where the lymph nodes, where the cheek is going to be enlarged. Okay, what is this? Okay, just by like saying that word African child where the cheek is going to be enlarged with that lymph node. It's actually lymphoma, so it's actually cancer. What is it? That's called as Burkitt lymphoma. Burkitt lymphoma. Okay, in Burkitt lymphoma, CMIC amplification is going to be seen. Okay, next, what else I should teach you is, look at these three histologies. Okay, now here I am showing you histologies of 3 different cancers. For example, the first one. Now the person came and now he is having some lung cancer. We have taken the biopsy to know which type of cancer it is. Now just by looking at it, you just come to a preliminary diagnosis kind of thing. What might be the cancer? See, the cancer, it is showing what? This pink color thing. Like, you know, the world appearance, the pink color whorls are there. What exactly is this? So these are called as keratin pearls. Okay, what are these keratin pearls? Keratin pearls. See, keratin, what exactly is keratin? It's an intermediary filament. Okay, it's an intermediate filament. It's an intermediate filament present in which cells? Intermediate filament especially present in the epithelial cells. If you are having a cancer to the epithelial cells, then those cancers are called as what? Then those cancers are called as carcinomas. Okay, carcinomas. Which carcinomas? Squamous cell carcinomas. So this is squamous cell carcinoma of the lung. Squamous cell carcinoma. So squamous cell carcinoma of the lung is going to show what? It's going to show keratin pearls. Next, what is this? What do you think? Just look at it and tell me, what do you think? So this is also a lung cancer. We have taken the biopsy, and under the microscope, what you are seeing? You are seeing what? You are seeing the glands. So multiple glands are there. Okay, numerous glands are there. So what is it? It is adenocarcinoma. Okay, it's adenocarcinoma. The last one, what you are seeing here, this is a little important. See, here these are the blood vessels. The walls of the blood vessels are staining blue color. Okay, there is a blue color staining. This is called as azopardy effect. This is called as what? Azopardy effect. See, this azopardy effect, it is seen in small cell carcinoma of the lung. Okay, this azopardy effect, it is seen where? Azopardy effect, it is seen in the small cell carcinoma of the lung. Now, I forgot to add one more point. See, how many types of lung cancers are there? There are 4 types of lung cancers: squamous cell carcinoma, adenocarcinoma, small cell carcinoma, and large cell carcinoma. See, the small cell carcinoma is also having one more name, okay, which is also very important. That's why I am adding here itself. The squamous cell carcinoma, sorry, the small cell carcinoma is also called as oat cell carcinoma. Okay, squamous cell carcinoma is also called as aka oat cell carcinoma. Okay, small cell or oat cell carcinoma of the lung, which is having worst prognosis, very bad type of cancer. Okay, why it is a very bad cancer, later I will explain you. Okay, now here look at this. Now oat cell carcinoma, just now I have discussed what is oat cell carcinoma. Oat cell carcinoma is nothing but the small cell carcinoma. Okay, small cell carcinoma. Now what you are seeing here is, when you look into the cells are having this stippled appearance. The chromatin is like this dots. Okay, this is called as salt and pepper chromatin. Okay, see what you are seeing here, the clusters of malignant cells, which are small, round and oval or spindle shaped, but that's not that important. Now what you can see is finely granular, okay, finely granular nuclear chromatin is seen, which will give salt and pepper pattern. Okay, salt and pepper pattern. So salt and pepper pattern is seen in which type of lung cancer? Small cell cancer. Azopardy effect, small cell cancer. Small cell cancer is also called as oat cell cancer. KRAS gene mutations associated with adenocarcinoma. Okay, adenocarcinoma seen in the periphery. EGFR1 activating mutations, adenocarcinoma. Small cell carcinoma, which genes, what is the genetic defect that is seen? Small cell carcinoma, it is Elmic amplification. Squamous cell carcinoma is because of mutation of P53. Okay, so this is how you should know the things. So histology is completed. Now after histology, the next important points which I want you to know is that these lung cancers are usually associated with, let me write here important points. See, these lung cancers are associated with paraneoplastic syndromes. So what are these paraneoplastic syndromes? And the name itself is that para means just side to the neoplasia. Means apart from cancer, just side to the cancer, they will also cause some other abnormalities. They are associated with causing some other syndromes. Okay, what exactly are they? See, imagine there is a cancer. Imagine there is a cancer, lung cancer, sir. See, this lung cancer, okay, this lung cancer, it is going to produce different types of hormones. Yes, of course, it's a lung cancer, but this lung cancer, this tumor is going to produce different types of hormones, like antidiuretic hormone, or is it going to produce some kind of like a parathyroid hormone, something like that. Okay, so this lung cancers, by producing different types of hormones, will cause different types of symptoms. So these symptoms are called as paraneoplastic symptoms. So I want you to know like which different types of cancers are going to cause paraneoplastic symptoms, that I will discuss now. Look, the first cancer that I am going to discuss here is oat cell cancer. Oat cell carcinoma. See, oat cell carcinoma is nothing but the small cell carcinoma. Oat cell carcinoma or small cell carcinoma. It is associated with the production of this oat cell carcinoma. It is associated with the production of ACTH and also antidiuretic hormone. So these two hormones are getting produced. Because of the production of ACTH, more and more cortisol will be released. That cortisol is going to cause Cushing syndrome. Okay, Cushing syndrome. Because of the production of excessive amount of antidiuretic hormone, ADH, excessively antidiuretic hormone is getting produced. So that will cause SIADH. What is SIADH? Syndrome of inappropriate antidiuretic hormone synthesis. Okay, syndrome of inappropriate antidiuretic hormone synthesis. Yes, you can clearly see, right? Syndrome where inappropriately antidiuretic hormone is getting produced. Who produces this antidiuretic hormone? It's a oat cell carcinoma. Oat cell carcinoma produces the antidiuretic hormone. Okay, Cushing syndrome. The person is going to have Cushing syndrome because of excessive production of ACTH. Okay, done. After this, what is the important point about this oat cell carcinoma? Worst prognosis. Out of all, this is having worst prognosis. Okay, it's going to show the worst prognosis. Then next, lung cancers which are associated with, which lung cancer is associated with gynecomastia? So what exactly is gynecomastia? Enlargement of the breast in the males. Okay, males are getting enlargement. So large, there is something getting larger, the breast is getting larger. So out of the 4 different types of cancers, which cancer do you think is going to cause enlargement of the breast? It's a large cell carcinoma. Okay, large cell carcinoma. Okay, large cell carcinoma is associated with gynecomastia. Next, squamous cell carcinoma. Squamous cell carcinoma. What is the important point about the squamous cell carcinoma? It's not the gynecomastia. So squamous cell carcinoma, this is the recent NEET PG MCQ asked just I think 6 months back. This is a question which was asked. The squamous cell carcinoma is associated with which paraneoplastic symptom? It is hypercalcemia. Okay, hypercalcemia, increase the blood levels of calcium. See, this is the one condition, very important. The squamous cell carcinoma is associated with the hypercalcemia. Why? Because the squamous cell carcinoma is going to produce a parathyroid kind of hormone, parathyroid hormone related peptide. Okay, something like parathyroid hormone related peptide. By producing the substance parathyroid hormone related peptide, it increases the blood calcium levels. Squamous cell carcinoma increases the blood calcium levels. Okay, so done. Now after this, what else you should know? Okay, what else you should know is, let me write important points about the adenocarcinoma. Okay, let me write here adenocarcinomas of lung, adenocarcinoma of the lung. See, out of all lung cancers, okay, in primaries, I am talking right now about the primaries. Most common is secondaries, okay. In the primaries, the overall most common is adenocarcinoma. Overall, most common. First point. Next, adenocarcinomas are seen in smokers or non-smokers? Seen in non-smokers. Okay. Next, seen in who are usually non-smokers? Usually females. So it's the most common lung cancer in females. Do you think children will smoke? No. So So it's the most common lung cancer in children. So overall it is most common. In females it's most common, in children it is most common. Okay, where it is located? You know it is located peripherally. Peripheral location. Okay, next. See, what else I want you to know is, look, there are certain lung cancers called as Pancoast tumors, which will come in the apex of the lung. Okay, look here. See, this is the lung tissue. Okay, let me show it with a different color. Okay, this is the lung tissue. Now in the apex of the lung, okay, in the apex of the lung, there is a tumor. Okay, there is a tumor in the apex of the lung. These tumors are called as Pancoast tumors. Okay, the tumors which are arising in the apex of the lung are called as the Pancoast tumors. Let me write. So what is the importance about the Pancoast tumor? Okay, Pancoast tumors. Simple, Pancoast tumors. So these Pancoast tumors are arising where? In the apex of the lung. So what? So these Pancoast tumors are going to compress. Okay, look here, this Pancoast tumor, it is going to compress this nerve plexus. It's going to compress the nerve plexus. Which nerve plexus? Okay, I will explain you. See, actually what happens is, you know the sympathetic outflow, right? From the thoracic and lumbar part of the spinal cord, from the thoracic and lumbar part of the spinal cord. Okay, the thoracic spinal nerves will come and lumbar spinal nerves will come. See, these spinal nerves, they contains what? They contains sympathetic outflow. Sympathetic outflow is also called as thoracolumbar outflow. So sympathetic outflow is coming from the thoracic and lumbar spinal cord. Okay. Now your head and neck, does they have sympathetic activity or not in your head and neck? Yes, there is sympathetic activity going on. Okay, there is sympathetic activity. What is the sympathetic activity that is going on in your head and neck? Something like lacrimation. That's parasympathetic activity. What is sympathetic activity? Sympathetic activity is dilation of the pupil. Okay, dilation of the pupil. Sweating is a sympathetic activity. Dilation of the pupil. Next, keeping the eyelid open, that's also a sympathetic activity. So these are the sympathetic activities in your head and neck. Sweating, mainly sweating, dilation of the pupil, that is mydriasis, and keeping the eyelid open. Okay, that's also a sympathetic activity. Now the sympathetic nerves, they will ascend up, okay, through the neck. These sympathetic nerves, they will go into the head and neck like this. Now here is a tumor. In the apex of the lung there is a tumor. See, these nerves, when they are ascending up, sympathetic nerves, they will be compressed and they are damaged. So because of this Pancoast tumors, okay, because of this Pancoast tumors, what happens? The sympathetic innervation to head and neck is lost. The sympathetic innervation to head and neck is lost, sir. So because of this loss of sympathetic activity in the head and neck, the patient is going to have which features? The patient is going to have meiosis. Second thing, the patient is going to have anhydrosis. Okay, meiosis is going to be there, anhydrosis is going to be there, as well as ptosis. Okay, so meiosis, anhydrosis and ptosis. Meiosis means constricted pupil, sympathetic activity is not there now, there is no sympathetic activity, parasympathetic activity is going to be dominant, so that causes meiosis. And anhydrosis means no sweating, sweating is not happening in the head and neck. And what is ptosis? Ptosis is drooping eyelid, the eyelid is getting drooping, okay, drooping of the eyelid. Normally it is a sympathetic activity which keeps the eyelid open, but because of the denervation, because of the loss of sympathetic activity, now the eyelid is going to droop like this, that is called as a ptosis. So let me show you the image also. Look here, see, in this child, this pupil is okay, dilated pupil, but this pupil, look, it is constricted. And when you look here, this the eyelid is drooping, there will be drooping eyelid even in this patient also. Okay, which eye is normal, which eye is not normal? See, this eye is normal with a dilated pupil, but this eye is having a small pupil when compared to that, and even the eyelid is also getting just drooping. Okay, drooping eyelids are going to be seen. So this syndrome, this entire syndrome that I have discussed, see, Pancoast tumors, okay, they are associated with meiosis, anhidrosis and ptosis. So this syndrome is called as Horner syndrome. Horner syndrome. Okay, so Horner syndrome, sir. So Horner syndrome is due to Pancoast tumors. Where Pancoast tumors will come? They come in the apex of the lung. Apex of the lung. Horner syndrome, what are the three symptoms? Ptosis, meiosis and hydrosis. Okay, and heterochromia is also going to be seen, different colored iris. In this one eye, the iris color is going to be a little less than the affected eye. Heterochromia means different colored iris. Okay, heterochromia can also be seen, but not that important. Anyway, done. So this is also completed. Next, in which type of lung cancer? Note MCQ. Large cavitating lesions are seen. Large cavitating lesions are seen in which type of lung cancer? Okay, large cavitating lesions are seen with squamous cell carcinomas. In squamous cell carcinomas, large cavitating lesions are going to be seen. That's one question which was asked long back. That's one thing which I want you to know. Apart from that, look at this and tell me, sir, on this CT, okay, sir, in this CT, what you are seeing? So these are the lungs. You can clearly say that's the air. Okay, the black color thing. Now in the lung, you can very clearly see there is this tumor present. Now this tumor, how it is looking like? It's looking like a popcorn. It's looking like what? It's looking like a popcorn. So popcorn appearance in the lung, okay, is seen in which kind of tumors? It's seen in which kind of tumor? Squamous cell carcinoma, large cell carcinoma, adenocarcinoma. Which type of cancer? Large cell carcinoma. Which type of cancer? No, these are not. See, it's seen in benign condition which are called as hematomas. Okay, pulmonary hematomas. In pulmonary hematomas, you will see popcorn calcification. So popcorn calcification is in pulmonary hematomas. Okay, so with this, different types of lung cancers are also completed. So lung cancers, their genetics, their location, their paraneoplastic syndromes. Okay, all these are the important points. The most common benign tumors are called as pulmonary hematomas, but the most common lung cancers are secondaries. In primaries, the most common lung cancer is adenocarcinoma. In female, adenocarcinoma. Children, adenocarcinoma. Also, don't forget about the Pancoast tumors and Horner syndrome. Okay, this video is completed. Hope the video is helpful. Thank you.